I want to talk to you a little bit about the healing of specific tissues. So, we have briefly hit on in pathophysiology and a little bit at the first couple lectures in this class on circulation and how that affects tissue healing and that sort of thing. So we're going to sort of talk about some specific tissues. This comes up a lot in PT because you're going to have a different course of treatment and different course of healing depending on the types of tissues that are involved. So important determinants of healing include the regenerative capacity of the tissue. In other words, some tissues just heal better than others. The vascular supply and the extent of the damage. So tissues have different capacities for healing. Cartilage generally does not have a very good blood supply. Tendons and ligaments slightly better, but I have this kind of rated kind of in order of how good a blood supply. Skeletal muscle has a great blood supply, as does bone. So because bone is such a metabolically active tissue, it has to have a huge blood supply to get that calcium and phosphorus in and out all the time. And so bone heals great because it's got a great blood supply. Cartilage that is closely related to an injured bone also heals better than cartilage that isn't, because that bone has the really good blood supply and it shares it with the cartilage. If it's only the cartilage that's injured, then you're not going to heal as well. Kind of not very fair, is it? But there you go. So cartilage, it has a limited ability to heal. It lacks lymphatics, blood vessels, and nerves. So cartilaginous injuries that involve the subchondral bone allow inflammatory cells to gain access to repair nearby cartilage. That's what I was just talking about. So say you had a tibial plateau fracture from a car accident. That's a pretty common one. And consequently, you also damaged the cartilage and the meniscus above the tibial plateau. Well, that's going to heal a lot better than if you just had a meniscus injury or just had a cartilage injury, because the bones involved and those inflammatory cells have a pathway to get to the cartilage. So I guess if you want to be a silver lining person, you go, oh, well, I damaged the bone, but at least the cartilage is healing better. I'm always a silver lining person. So tendons and ligaments, the potential for repair of the tissues depends on the type of tendon or ligament, of course, the extent of the damage, the vascular supply, and control of movement. Because we know tendons and ligaments, they're preventing movement or they're transmitting movement. And so if you can protect it during the early healing phase, during that proliferation phase when it's not as strong as it could be, then you will have a better chance of recovering. Taking in consideration the extent of the damage and the type of damage as well. If healing occurs, so if you've got everything's working for you and you're occurring, tendons possess a unique scar maturation phase that can achieve an advanced state of repair. So wow, isn't that neat? So you can actually get, if you are set up with the right vascular supply and control of movement and everything, you can get a super strong heal on a tendon. If some of that stuff isn't right, though, you can have a weak healing and re-rupture it. Unlike tendons, ligaments heal better with controlled passive mobilization. So tendons, you really have to protect them so they can get through that scar maturation phase. Ligaments, you want to do controlled passive mobilization. So you get more circulation to the area if you do that controlled passive mobilization. Tendons, you want to protect them so they can get through their scar maturation phase. Skeletal muscle can be injured by trauma, strain, or muscle diseases. Healing can occur in some cases through stem cells that can proliferate and differentiate. So we still have muscle stem cells available, and you can get actual regeneration, not just reconstruction but regeneration. And so that's what's great about muscles also have a fantastic blood supply, and so they heal better. They have stem cells and they have a good blood supply, so they've got that going for them. The tendon at the musculotendinous junction, where it's closer to the muscle, it can benefit from that increased blood supply and heal a little bit better than tendon that's a little more distant from the musculotendinous junction. After a severe muscle contusion, you can actually get a calcified hematoma, which has a little bit different healing curve, basically, and we don't want to do soft tissue mobilization with it while it's calcified because we can further damage the tissue. I have worked with people who had impact injuries, trauma from playing sports that ended up in hematoma in the quadriceps, calcified hematoma, and it takes longer for it to resolve, basically, than a regular muscle injury. Bone has 4 distinct stages of healing, and you probably talked about this in your anatomy and physiology class. Shortly after the impact that causes the bone injury, you have an inflammation stage. There's a hematoma created that disrupts the blood supply and lowers the pH. You get a soft callus forming after the swelling subsides. It stabilizes the fracture, it decreases pain, and it reduces the chance of a fat embolism. Because remember, in the long bones, we have that fatty tissue in the medullary space. The hard callus forms 3 weeks to 4 months out, and that corresponds to your clinical healing period for a fracture. Bone remodeling takes months to years, and remember, just like other tissues, just like scar tissue, bone remodels in response to the stresses you put on it. So healed fibrous bone, which is the hard callus, is converted to lamellar bone, and the medullary canal becomes open again, becomes patent again. So it takes a long time, and once you've got the clinical healing, then you have to start doing weight-bearing activities, and you have to stress the bone in the right way to get that good bone remodeling. So even though you're clinically healed in 3 weeks to 4 months, 4 months being the outside, it takes a while to get back to normal bone remodeling, months to years. So, and we know there are a lot of different factors that contribute to that.